viewers and listeners. On today's COVID-19 update, Minister of Health, Dr. Frank Anthony, is urging pregnant and breastfeeding women to get vaccinated against COVID-19.
So most of the obstetric societies globally have been encouraging pregnant women to get vaccinated in any one of the trimesters, whether first, second, or third, because the vaccine is safe and it is protective. Observing from the cases that we have locally, almost every day we are seeing between 15 to 20 cases of persons with COVID-19 who come into our hospitals. Currently, we would have had cases at Ocean View. We have cases here at the Georgetown Public Hospital. And it is a challenge to manage these patients, especially if they have some form of respiratory distress. So that is posing a challenge.
In addition to the AstraZeneca, Sinopharm, and Sputnik V vaccines, the Pfizer vaccine is now being offered to women in this category.
In terms of pregnant women, they have to be enrolled at one of our clinics. So we have to verify pregnancy, and that would be done at any one of the clinics. So that's how we'll verify that. In terms of how do we know who is breastfeeding? Again, when you're discharged from your clinic, having been pregnant and delivered a baby, when you're discharged from the hospital or the clinic, you will get a clinic card. And so from that clinic card, we'll know that you're breastfeeding. So once you meet those two criteria and you have those two documents to produce, we'll administer the vaccine.
Dr. Anthony also noted that there are rare instances of a person being unable to take a COVID-19 vaccine.
So the need for an exemption is a very rare occasion. The only reason why you would get an exemption, there are probably two reasons. One is that if you have an allergy to one of the vaccines that we are using, then you can be exempted. And secondly, if the components of which the vaccine is made of, if you're allergic to one of those components, then you can be exempted.
Those persons exempted for a medical reason must go through a thorough examination by a medical practitioner.
Some people have been issuing exemptions, but the exemptions cannot be based on any serious medical illness. And so some of those letters that have been issued, we are investigating them. And if they were issued without proper medical information, let's say somebody just write a letter of exemption without doing proper medical investigations and so forth, and that person warrants the exemption, then we are going to put those medical practitioners before the medical council.
He also provided an update on the current COVID-19 vaccination numbers.
As of yesterday, in terms of our adult population, we would have completed 365,274 persons getting their first dose of a COVID-19 vaccine. That is now 71.2% of our adult population receiving a first dose vaccine. We've also completed 218,120 persons receiving their second dose, meaning that they're now fully vaccinated. So 42.5% of our adult population is now fully vaccinated with a COVID-19 vaccine. As it relates to persons between the ages of 12 to 18, we've had 25,510 persons receiving a first dose of the Pfizer vaccine. That's 35% of that age cohort. And for second dose, we would have given out 14,367 vaccines. So we have 14,367 persons, or 19.6% of that age cohort being fully vaccinated. I mean, the COVID-19 vaccine helps to stimulate your immune system so that your immune system would be able to recognize this invading virus. And once it does so, it would be able to respond appropriately and quickly to reduce the spread of the virus in your body. Again, I think I've said this before, your immune system, you have what is called an innate immune system and an adaptive immune response. The innate response takes about 7 days, so if an unknown virus comes to your body and presents itself to your immune system, that innate response takes at least 7 days to be properly activated. And after 7 days, then the adaptive immunity kicks in. But in 7 days, if you're infected with COVID, a lot of damage can be done. So that is why when you get a vaccine, it would prime your body so that instead of the innate system taking that long, it kicks in faster and your adaptive immunity is almost immediate, so that your body is better able to respond to the presenting virus, and therefore you'll stop the multiplication of this virus in your system.
That's it for today's COVID-19 update. For more information, visit dpi.gov.gy or health.gov.gy and our social media platforms.